Okay, Madam Chair, we are now live.
Thank you very much. Good afternoon. I call this Finance and Government Operations Committee meeting of the City Council to order. Today is October 25th, 2021. Councillor Harris will be joining us later in the meeting, and all other committee members are present today via Zoom. This is a remote or online meeting where all participants will be on a video or audio conference. We appreciate your patience as FGO meetings are conducted this way. No written comments were received for today's meeting, and members of the public have had the opportunity to address the committee if they have signed up for live public comment per the rules published on the agenda and on our website Friday. Members of the public, city staff, and the media have the ability to view this meeting live through YouTube and Zoom webinar. The live stream can be accessed from most smartphones, tablets, or computers. For those watching on live stream, thank you for joining us. We are going to start with public comment. Mr. Moya, do we have people ready to rock?
Madam Chair, we did have 3 people sign up to speak, but none of them have joined the meeting yet.
Okay.
If you'd like to move on, and I can let you know when some do.
That would be perfect. Thank you so very much. So unless they join us later, we're going to move on to agenda item A, EC 440. This is second amendment to lease between the General Services Administration and the City of Albuquerque for TSA use of the old terminal building. I move approval. Thank you, Councillor Sena and Councillor Borrego with the second. Councillors, do you have any questions? I see that Director Allen is on with us. I don't know if there's something further that you would like to add, Director, or if...
No, Councillor, nothing to add.
Great, thank you. Thanks for being here. Okay, so being that there are no other questions or comments, Ms. Hinojos, if you'll take the vote, please.
Councilor Borrego.
Yes.
Councilor Peña.
Yes.
Councilor Sena.
Yes.
Councilor Bassan.
Yes.
That passes unanimously on a 4-0 vote.
Thank you. Agenda item B is EC 443, transmitting the year-end status report on fiscal year 2021 objectives. I move a receipt be noted. Thank you, Councillor Sena. Any questions or comments, councillors? Ms. Hinojos?
Councilor Borrego.
Yes.
Councilor Peña.
Yes.
Councilor Sena.
Yeah.
Councilor Bassan.
Yes.
That passes unanimously.
Thank you. Agenda item C is EC 444, fiscal year 21, goal number 1, priority objective number 6, aging population study. I move a receipt be noted. Thank you, Councillor Sena. Councillor Borrego with a second. Any questions or comments, councillors? Councillor Sena?
Thank you, Madam Chair. Can we get Director Sanchez to just do a brief overview of this study? I think it was really illuminating. Maybe just a 5-minute quick overview of this.
Thank you for being here, Director Sanchez, if you will.
Is it possible to share my screen by chance?
Yes.
Madam Chair, yes. Give me 1 second. And Director Sanchez, you should be able to now.
Okay, let me see if I can figure this out.
Councillor Bassan,
Yes, ma'am.
I was just going to say we're all aging over here.
I promise. Here we go.
Slowly.
Okay, let me see. Can you see that?
Yes, ma'am.
Okay, here we go. I wanted to give a 1-page snapshot, so I appreciate certainly the counselors for this opportunity to give a quick overview. But I thought that this would be helpful to kind of dive really quickly into some of these. Let me turn off my email so it doesn't keep popping up as well. I apologize for that. Just turn that off completely. Sorry about that. Let me stop sharing just so I can close my email so it won't keep beeping on you. I apologize. Should have closed it before the meeting. I have a lot of emails open, so I apologize. right, let me try to share again. Apologize. Go. Okay. So I provided you some quick snapshots from this aging study. First, to highlight the issue of aging in our community is a huge task. I certainly like to thank Councilor Pena for the opportunity to do this study. This is a very timely conversation, but not just one for Albuquerque and Bernalillo County, but it's a worldwide conversation, because by 2030, more people will be over the age of 60 than under 10 years old. So what does that actually mean for us? There are many benefits to having this conversation, but there's also difficulties and realities. And that makes this issue a real challenge to immediately produce a whole prioritization of programs and services, even though we will have those to propose in the future. This is not a one-size-fits-all answer for our community, because this issue is very complex and something that our department sees every single day. We've seen it during this pandemic, that we are serving older adults that range from healthy, active, highly productive community members to those that have needs for assistance to conduct daily tasks of living. That means that they're isolated, homebound, they're struggling with mental illness, they're struggling with memory loss, life-limiting illnesses. So it is a huge gamut of individuals that we're talking about that will continue to grow in our community. Some of the eye-opening statistics and factors of this study, I'm going to try to make it a little smaller so you can see all of it, I believe, is that the percentage of older adults in Bernalillo County is increasing at a higher rate compared to those of younger age groups. I don't know if you guys saw in the Albuquerque Journal, a few months ago when the census came out with its complete study, that for the first time since 1900, we've had the lowest annual population growth rate since 1900. When I read that, that was pretty shocking. And so we really need to look at how we have fewer young people in our community that are contributing to the economic and social systems that support dependent populations, such as older adults. Additionally, most think that population aging is only having to do with having a large adult population, but it's actually much more than that. It's when you have a larger percentage of older adults compared to younger people, and you have that stagnant birth rate. People are living longer. My projection for living is probably into my 90s, perhaps my 100s, but you're managing multiple diseases later on in life as you continue to live longer. This study demonstrates that we all play a part in population aging, regardless of our chronological age. What we've also learned is that smart cities, such as I like to believe that Albuquerque is that we can actually incorporate buy-in at every level of government, such as what you are doing today with listening to this aging population study. We're trying to make aging a top priority. And how can we think about our city's plans for economic growth, urban development, and the expansion of health and community services? And lastly, how do we create a community conversation around this so that younger generations can prepare for longer lives in our community? Scroll down here. This aging study actually pinpointed specific efforts that we can undertake to develop a strategic, long-term plan to prioritize programs and services for older adults. Some of these efforts actually include using our already existing asset inventory, known as our age-friendly action plan that was adopted by AARP, to build more partnerships that will allow us to augment and improve existing programs. And we know that the city of Albuquerque is already known for a robust Department of Senior Affairs. I believe that we all believe that this department is one of the best in the country. And we know that we have services and programs that are unlike anywhere else. But how do we continue to build that capacity within DSA to do more? And that way, aging is actually considered in all areas of urban, civic, and community growth, such as economic development, how we grow, thinking of ways to keep older adults in the workforce longer and support adult entrepreneurship is an idea, thoughtful planning for our city, including transportation, features that allow people of all ages and abilities to live well and stay connected in their communities. We took that action not that long ago. Under our Deputy Director in Transportation, we expanded all of our transportation routes, servicing new senior centers to bring people from their homes to our centers. And then also supporting aging, healthy aging, creating more cross-sector collaborations to increase care and health resources. So this study says that we should ensure that our current young people consider how they will be the future old, and how the topic of aging should determine how our city grows, as well as encourage intergenerational involvement tackling issues around aging. These are only a few of the ideas for long-term planning that DSA can lead if we're able to build capacity internally, to work with other city departments, government entities, other stakeholders. And this study has helped the department launch efforts to really understand how our current services are operating and if they're effective. still in the midst of this public health emergency that we're still in. All during this pandemic, we have launched our age-friendly committee to help us work on some of these advocacy efforts, and then we will be able to produce policies or recommendations for this council for the future. So with that, have any questions? I see Councilor Pena.
Thank you, Dr. Sanchez. Thank you, Madam Chair. Director, so thank you. And yeah, this is something that I think when I first came into office, there was a study out saying that we were going to be confronted with this sooner than later. So we needed to address it then. And my whole thing was that on the southwest area of Albuquerque, we didn't even have one single senior amenity for that sake. And then, so we just managed to finish, that whole, it's been for the 8 years that I've been here, we opened the respite center, which is cool, but we're still just even behind the 8 ball in the southwest area. And then the study, which I'm glad we did. I'm excited. This is lots of good information. Now I have some backing for when I'm arguing all this stuff. But anyway, I just wanted to say that, I know you talked about partnerships, and I was wondering, and maybe some of the counselors that are on here now, just moving forward, we can do a resolution to really develop an action plan, or do you have like an action plan already in the works, or should we formalize it? Because, my complaint too has always been that senior affairs, you do some remarkable stuff, like even during the pandemic, the gazillion meals that you guys distributed, and yet you have probably one of the lowest budgets at your department that, so I think we really need to look at that and really have some tangible things that we really need to move forward, so that we're not talking about this 8 years from now, or, well, if I'll be here 8 years, but, into the future. So.
Answer. Members of the council, Councilor Pena, thank you for that question. Certainly, we do have an action plan that has been adopted by AARP and the World Health Organization. The city of Albuquerque has that designation as of January of this year. It would be a wonderful first step for this city council, or similar to other communities that have actually formally adopted that action plan, which not only engages other city departments in this work, but also other stakeholders, community groups, businesses. We need to have this conversation on a larger platform, and if city council could consider doing that, that would be wonderful.
Okay, so I'll get the ball started, and if all the as Councilor Borrego suggested, us old ladies, maybe we'll put a resolution together. Thank you, Director.
Councilor Borrego.
I didn't say old ladies, Counselor. I just said we're aging as we sit here. I just want to thank you, Director, for the work that you've done with Cibola Loop. I just want to commend you and thank you for, I know you're leading the charge on that. And as Councilor Pena mentioned, we have limited services. I know in her district, in my district, probably in Councilor Sena's district, especially on the west side. But I just wanted to ask in terms, and only because I don't have a senior center yet, and I'm excited to get one eventually, but we do a lot of coordination with the county, and I know that there is Paradise Hills Community Center where they offer meals to the seniors. I'm just wondering how that's going. Are we still doing that? I know that pandemic has come, and I guess it's still here as far as I know. I'm just wondering what the status is of providing, because you mentioned transportation, but you didn't mention meals. So I'd just like to know where we're at on that.
Members of the council and Councilor Borrego, thank you for that question. Transportation is one little area, but our meal service has been nonstop since the beginning of the pandemic. We did make a lot of changes to our processes to work with our other partners, such as the county. Paradise Hills is now open and functioning. Taylor Ranch Community Center is another one where we serve our meals, which you provided some funding to be able to bolster up that senior meal site. I think right now all of our facilities are operating with still some uncertainty. So we've been working with those partners very closely. What's been very exciting also, though, is that we've also had some renewed energy with folks coming back with new programming and things that we're offering at those sites in addition to the meal services. So that's been really important for us as well. So I just appreciate that question because we can give you data in all the different areas of folks that we are serving meals and where they're coming from. And we are doing a lot more evaluations and surveys to find out whether or not people are appreciating, if they're looking for something different, but a lot more evaluations of our current programs that we'll be willing to share with the council as well moving forward. So Cibola Loop is our hope and our dream, because that actually is going to be another crown jewel in our community. And that's one that actually will be speaking on a national level to AARP next Friday that I'm going to actually tout. So I'm going to be talking about our whole multi-generational center, prize that we have here in our community. So I just wanted to share that with you as well on the council.
Can you also provide us information about how many meals you serve on the west side, especially in my district? I'm interested. And also the coordination that you do with the county and also the Meals on Wheels, if you would.
Members of the council, Councilor Borrego, we'd be happy to do that. I could get you that information broken out by zip code. Meals on Wheels is a separate entity. We did partner with them during the pandemic. They do not receive any particular funding, but we do work very closely together. So I can also be able to kind of share a little bit of that work that we did during the pandemic with them specifically, if you would like.
Thank you so much. Thank you, Councilor Bassan.
Thank you all, and I appreciate you talking to us, Director. That was a very good presentation and all that you're doing with everybody. So any other questions or comments, counselors? Ms. Hinojos, if you will, please.
Counselor Borrego,
Yes.
Counselor Peña,
Yes.
Counselor Sena,
Yes.
Counselor Bassan.
Yes.
That passes unanimously.
Agenda item D is EC 453, lease agreement between CLN Kids and the City of Albuquerque at John Marshall Health and Social Service Center at 1500 Walter Southeast. I move approval. Thank you, counselors, Counselor Sena and Counselor Peña. Any comments or questions, counselors? I see that Counselor Harris has joined us. Welcome.
Well,
Mr. Ramirez, would you care to enlighten us with a little bit?
good afternoon, Council. Thank you, Madam President. We're moving forward with just a lease renewal. CLN has been a longtime provider over at the John Marshall Center, providing wonderful services for families experiencing homelessness and their children. So we're just making sure all our leases are updated and moving forward.
Thank you very much. All right. All right, Ms. Hinojos, if you will please take a vote on moving of approval of EC 453.
Counselor Borrego,
Yes.
Counselor Harris,
Yes.
Counselor Peña,
Yes.
Counselor Sena,
Yes.
Counselor Bassan.
Yes.
Thank you. That passes unanimously.
Moving on to agenda item E, EC 454, approval of the first supplemental agreement to add monies for FY22 outside council legal services between Piper, Hansen, Mullins, and Baker, PA, and the City of Albuquerque. I move approval. Thank you, Counselor Borrego. With the second, any questions or comments, counselors? Ms. Hinojos.
Counselor Borrego,
Yes.
Counselor Harris,
Yes.
Counselor Peña,
Yes.
Counselor Sena.
Yeah.
Counselor Bassan.
Yes.
Passes unanimously.
Thank you. Agenda item F is EC 455, Legal Department's quarterly litigation report for the third quarter of FY 2021 greater than 10,000. I move a receipt be noted. Thank you, Counselor Sena. Any questions or comments, counselors? All right, Ms. Hinojos.
Counselor Borrego,
Yes.
Counselor Harris,
Yes.
Counselor Peña,
Yes.
Counselor Sena.
Yes.
Counselor Bassan.
Yes.
Passes unanimously.
We will now move on to agenda item G, EC 456, Legal Department's quarterly litigation report for the fourth quarter of FY 2021 greater than 10,000. I move a receipt be noted. Thank you, Counselor Sena. Any questions or comments? Ms. Hinojos?
Counselor Borrego,
Yes.
Counselor Harris,
Yes.
Counselor Peña,
Yes.
Counselor Sena,
Yes.
Counselor Bassan,
Yes.
passes unanimously.
Agenda item H is EC 457, request for FY22 substance use treatment voucher contractors to exceed $100,000 funding aggregate. I move approval. Counselor Sena, thank you for the second. Any questions or comments? Counselor Peña?
Is Director Pierce on the call? I don't see her.
Councilor Peña, Gilbert Ramirez, Deputy Director here. I can answer questions around.
Oh, okay. Just a quick, with the vouchers, and it looks like you're going to be contracting with several nonprofits to distribute them. I just kind of want an update on a brief update, if you will, just on how the vouchers is working out.
Absolutely. Thank you, Councilor Peña. So this year we've seen a spike in actual utilization, and we expended all of the money in that funding pot for our providers. What it does allow for is folks who don't have full Medicaid or insurance coverage or have commercial insurance, but sometimes have co-pays that limit their ability to be able to seek out treatment to receive that. So we have seen a very high peak with regards to access to services. This pool does allow us to be able to, instead of just give it a limit of money to one agency, is to have a network of providers, and folks can choose those providers, call in, get an intake, and begin their treatment. It does follow the levels of care for our national federal guidelines. We give care up to level 2.0, which is kind of outpatient treatment and services and assessment. Voucher is good for 1 year. And then upon approval, if necessary and recommended by the clinician, we can review it to actually extend that level of care. This year, we also really worked hard to extend our services in partnership with the courts. A lot of individuals who are coming out of court, unfortunately, don't have the financial ability to pay for their treatment. And so again, that was just a great partnership with regards to referring folks to the network and the voucher pool to be able to support them in having that treatment and also being compliant and staying out of incarceration. So we appreciate the support very much, and I'm not sure if this answers all your questions, but happy to take any others on.
Madam Chair, yes, it does. Thank you. I appreciate it, because I know a lot of people getting out of jail, they're one of the things they have to do, and then they can't afford it, and then they go back in jail just because they couldn't afford it. So thanks, I appreciate it. Take care.
Counselor Borrego?
Oh, thank you, Mr. Ramirez, for answering our questions. My question is with regard to grants. Does the city supplement this program in addition to the funding that we receive with other grant funds?
This particular funding is not supplemented. The reason it allows us to be able to provide that treatment is because it's a general fund. We have more flexibility in how we use it. Sometimes the grant funding does limit that, but we have applied for grants that also support substance use as well as case management services specific to that. We're actually awaiting notification for a DOJ grant we applied for that will hopefully come to us at the end of this month. So we're constantly looking for building revenues and programming, but we do understand that this particular program does serve a group of folks who may not have insurance, gaps in that insurance, or their co-pays exceed a certain amount over the year. And sometimes there are some limitations with regards to folks who are on Medicare and or other insurances, and so therefore they won't pay for the treatment, and they can utilize this voucher for that.
So one more question, Madam Chair. I had with regard to the Attorney General's lawsuit for the oxycodone, would this be something that eventually maybe the city would be in receivership for if we, are successful in that lawsuit?
Madam Chair, Councilor Borrego, thank you for that question. Yes, the city is part of that class action lawsuit, and I was fortunate enough to be part of our last updating meeting. That class action lawsuit is moving forward. Our legal department is kind of championing our efforts around that. It's a long process, and it also will be determined how many folks are part of the class action lawsuit that then will decide what the funding would look like both for state and counties and cities who join the class action. So I continue to get those updates. We would love to see how much money would be available once it's actually settled and distributed to the municipalities. But as of this time right now, we do not have any clarity on how much that would be and how much further it will take to actually have that case settled, and then the funding to be distributed to the local municipalities, the states, etc.
Thank you for that.
Thank you, Director. And I like your new background. That's pretty cool. All right, Ms. Hinojos.
Counselor Borrego,
Yes.
Counselor Harris,
Yes.
Counselor Peña,
Yes.
Counselor Sena,
Yes.
Counselor Bassan.
Yes.
That passes unanimously.
Agenda item I, OC 43, Office of Internal Audit's Annual Report for Fiscal Year 2021. I move a receipt be noted. Thank you, Counselor Sena. Any questions or comments, counselors? Ms. Hinojos?
Counselor Borrego,
Yes.
Counselor Harris,
Yes.
Counselor Peña,
Yes.
Counselor Sena,
Yes.
Counselor Bassan.
Yes.
That passes unanimously.
Thank you. Well, moving on to agenda item J, OC 44, Office of Inspector General's Annual Report for Fiscal Year 2021. I move a receipt be noted. Thank you, Counselor Sena. Counselor Borrego. Any questions or comments, counselors? Ms. Hinojos?
Counselor Borrego,
Yes.
Counselor Harris,
No.
Counselor Peña,
Yes.
Counselor Sena,
Yes.
Counselor Bassan.
Yes.
That passes on a 4-1 vote.
We will now move on to agenda item K, 076. This is for Counselor Jones. Adopting a uniform administrative code and technical codes prescribing minimum standards regulating the construction, alteration, moving, repair, and use and occupancies of buildings and structures and building service equipment and installations, including plumbing, swimming pools, electrical, mechanical, signs, solar, energy conservation, building conservation, and the abatement of dangerous buildings within the city of Albuquerque, providing for the issuance of permits and collecting fees, therefore repealing Chapter 14, Article 1, ROA 1944, the present uniform administrative code and technical codes, including the building code, the plumbing code, the swimming pool code, the mechanical code, the solar energy code, the electrical code, providing for penalties for violation of the code. I would like to move deferral to November 8th. Thank you, Counselor Sena. Any questions or comments? Ms. Hinojos?
Counselor Borrego,
Yes.
Counselor Harris,
Yes.
Counselor Peña,
Yes.
Counselor Sena,
Yes.
Counselor Bassan.
Yes.
Passes unanimously.
And moving on to agenda item L, it's a little shorter. This is 077 for Counselor Davis, amending Article 20 of Chapter 13 of the Revised Ordinances of Albuquerque, the Albuquerque Tax Preparer and Consumer Rights Ordinance regarding requirements for tax preparation services. I move a deferral until November 8th. Thank you, Counselor Sena. Any questions or comments, counselors? Ms. Hinojos?
Counselor Borrego,
Yes.
Counselor Harris,
Yes.
Counselor Peña,
Yes.
Counselor Sena,
Yes.
Counselor Bassan.
Yes.
Passes unanimously.
Counselor Sena, if you will go ahead on with agenda item M, R192.
R192 is requiring the city of Albuquerque to enter into a project labor agreement with the construction partners performing the construction of a new multi-purpose soccer stadium upon the bond approval by New Mexico voters on the November 2021 ballot. I move a deferral till November 8th.
And I see Counselor Borrego with a second. Any questions or comments, counselors? Ms. Hinojos?
Counselor Borrego,
Yes.
Counselor Harris,
Yes.
Counselor Peña,
Yes.
Counselor Sena,
Yes.
Counselor Bassan.
Yes.
It passes unanimously.
Counselor Sena, if you will take agenda item N, R204.
Thank you, Madam Chair. R204 is approving the Transit Department's 2021 updated Public Transit Agency's safety plan. I move a do pass.
Thank you, Counselor Borrego with a second. Any questions or comments? Counselor Borrego, do you have a question?
No, sorry, I was seconding.
Okay, thank you. Counselor Sena.
Thank you, Madam Chair. Can we just get a brief overview of this as well, like just a 5-minute quick run through?
Yes, Director?
Madam Chair, Counselor Sena, yes, I'll give you a brief overview. If you need something a little more in depth, I'm happy to have our senior planner, Andrew DeGarmo, give you some more details. Essentially, this is a safety plan that's required by the FTA. It was approved last year on FY 21. And every year it asks for us to do updates, periodic updates on what we need to do to that safety plan to make sure it's as efficient as possible. Some of the things that we're doing for this year is actually naming someone who's going to be an interim chief safety officer. We're naming, we're going to use our dispatch office to track and log concerns or complaints regarding safety, so they can record that as well. Just giving our employees a better opportunity to record and track safety incidents and accidents that are happening out in the field.
All right, thank you, Director Holcomb. Thank you, Counselor Sena. Any other questions or comments? All right, Ms. Hinojos.
Counselor Borrego,
Yes.
Counselor Harris,
Yes.
Counselor Peña,
Yes.
Counselor Sena,
Yes.
Counselor Bassan.
Yes.
Passes unanimously.
All right, and our last agenda item is OR208. This is for Counselor Gibson. Encouraging the city of Albuquerque to complete the funding for the renovation of Los Altos Park, adding a facility to house a security patrol vehicle and to this vehicle to the scope of the park renovation, prohibiting the sale of alcohol at Los Altos Park, funding a feasibility study and design analysis report to construct a footpath around the perimeter of Los Altos Golf Course. I move it to pass. Anybody second? Counselor Peña?
Madam Chair, I'd actually like to just move because I know I spoke to Counselor Gibson and I generally support kind of what she's trying to do here, but starting to get some calls and the fact that we haven't had much time to talk to or have people give public comment on this, I'd like to support it and just move it with a no rec to the full council. And then we can make amendments at that time. Just because I think we need to give an opportunity. I've been asked to allow people an opportunity to sign up for public comment and give some input in the interim.
Second.
Okay. I will go ahead and change my motion to a motion without recommendation I don't know if we really did a Counselor Peña for a second, but it sounds like you will second it and then Counselor Harris too.
Okay.
Thank you. Counselor Borrego.
I also had some questions regarding this with regard to the funding. It's asking us to complete the funding, but it's not really clear. And I've had some questions also from individuals that would like to know where that funding is going to come from and how we're moving forward with that. So I'm supportive of the no recommendation so we can get some questions answered.
Okay. Sounds good. Well, then I'm going to confirm with you, Counselor Borrego, that you're okay with us talking about these questions and answers at full council then, rather than tonight, correct?
Yes.
Okay, thank you, ma'am. I see in the mayor's conference room, I don't know if you have anything to add, or I just want to check back before we move forward without recommendation.
Madam Chair, no, we've got nothing to add. We were just requesting moving forward without rec, so we have time to talk to some other people. Thank you.
You're welcome. Thank you. So if there are no further questions or comments, Ms. Hinojos.
Counselor Borrego,
Yes.
Counselor Harris, Counselor Harris, Counselor Peña,
Yes.
Counselor Sena,
Yes.
Counselor Bassan,
Yes.
Counselor Harris, are you there?
Yes. Sorry, I couldn't unmute myself.
It's okay, thank you. That passes unanimously.
Thank you so much. Well, counselors, I'm sorry that we didn't delay longer, but I think that's it. And apparently we're getting older, so it's good that we can go get the early bird special. I see, Mr. Baca, are you wanting to delay our meeting a little bit? No, okay. Without, yeah. There being no further business, this meeting is adjourned. Have a good night.